So with the dentist, definitely every 6 months to get all that tartar buildup to clear out, keep the gums healthy. Healthy gum really is the foundation of a healthy mouth, healthy environment. It also will tell us if there are any issues that kind of we're keeping an eye on, and now it's getting worse. Really need to kind of address it now, and we can't wait. I like to do that a lot and kind of see something, and the patient's not ready yet, or it's too small. I don't want to touch a tooth that has a very, very small cavity in it, and take out a lot more tooth structure that might be healthy. When it gets to the time, I'm like, okay, well now we're ready. Or if the patient doesn't come see me for a year or two, then it becomes a root canal, and then we're like, okay, well there's not much we can do at this point. But a lot of patients, you find, especially as people age, or they have multiple restorations, or a lot of work done, people need to come in even more frequently than every 6 months. And 6 months is just not enough. Some people have a tendency to accumulate plaque a lot faster. So they want to clean that out before 6 months, because by the time they come to me at 6 months, the inflammation process, the gingivitis, has already started, and that's a negative effect. It's all about prevention. If we can keep the environment clean fast enough, where it just doesn't start creating the bacterial biofilm and the inflammation process, then we really kind of stay ahead of it. That way it will sets the groundwork for much healthier mouth environment, the teeth to last longer. So it really makes a difference. Like, over time, it's really a lot more cost effective to do those regular cleaning appointments and exams in a timely fashion, because you don't do cleanings for a long time, and you just wait and wait. Then you come in, it's not a regular cleaning anymore. At this point, it's a more involved cleaning. It's a deep cleaning. And deep cleaning costs 3-4 times, sometimes much more than the 3-4 times regular cleaning costs. So that one regular cleaning can also save you from, like I mentioned, it could be a small cavity today, but you come to me in a year, then it's a root canal. A small cavity costs you a few hundred. A root canal and a crown costs you a few thousand. I mean, we're talking a huge difference, in terms of getting the price in kind of, more economical. And then, there's a situation where if you, let it go for too long, that gingivitis becomes periodontitis, which means bone loss. And bone loss, bone is the foundation of teeth. It's what's holding the teeth in place. If you keep letting that process continue, not only it's going to be hard to kind of slow it down later on, because you can never stop the process. Once that bone loss starts, the process of bone loss and recession starts, there's no stopping it. And unfortunately, we can't regrow the bone. So all we have at that point is how can we slow it down to the point that it's negligible. And you can't do that if you're not on top of your appointments, and you're not coming in quick enough to kind of stop the process of inflammation, and then prevent that tooth from being lost. And lost tooth is, there's a lot of issues that kind of cascade from there, not being able to eat properly, then having to, replace it. What are we going to replace it with, and that's costly,
Sure.
So definitely helps.